Welcome to the deep dive. Today we're getting into something pretty specific, but really fascinating. Bone fractures in large ungulates.
That's right.
Specifically, we're going to look at two very different groups. You've got the Camelidae family, so camels, llamas, alpacas, and then the Cervidae, your deer, elk, moose.
Very different animals.
Exactly. And our goal here, our mission for this deep dive, is to figure out how they break bones, how they heal, and critically, why managing these injuries is just worlds apart depending on the species.
It really is.
And that tells us some surprising things about their biology, their behavior, even our interactions with them.
Definitely. And, before we get into the species specifics, it's worth remembering there are some universal basics.
Okay.
Like how bones break and how they heal. The fundamental biomechanics apply across the board. A fracture is essentially a structural failure. Force meets bone, bone loses.
Right.
Understanding that baseline is key before we see just how differently things play out.
Okay, so let's start right there. Basics. What is a bone fracture in these big animals and, well, what usually causes them?
Well, simply put, it's a break, a loss of continuity in the bone, and the causes. We tend to group them into two main types. First, and definitely the most common, are traumatic fractures. This is when healthy bone just gets hit with too much force.
Like a car hitting a deer.
Exactly. Or a bad fall, animals fighting. You see that a lot during rutting season. Or even, birthing problems or issues during handling if they're not wild.
Gotcha. And the second type?
Those are pathologic fractures. And these are different because the bone breaks with very little trauma, sometimes almost none.
What's that?
Because the bone itself is already weak, compromised by something else maybe. Bone cancer, metabolic diseases like rickets or osteoporosis, even infections like osteomyelitis.
And I find this part really interesting, the physics of it, how different forces actually cause different kinds of breaks, like the bone tells a story.
It absolutely does. The fracture pattern is like a blueprint of the forces involved.
Right.
So take tension, a pulling force. That can cause an avulsion fracture where maybe a ligament just rips a piece of bone off.
Right.
Compression, pushing, or squeezing often gives you oblique patterns, especially if there's some bending involved too.
Bending, so like the bone curves.
Exactly. It creates a tension side and a compression side. That typically leads to a transverse fracture straight across. And sometimes you even get this triangular piece, a butterfly fragment on the compression side.
Butterfly fragment.
Yeah. Then there's torsion, twisting. Think of wringing a wet towel that gives you a spiral fracture.
Okay.
And shear forces sliding past each other can also make transverse lines. But, in reality, most accidents involve a mix of these.
Right. It's probably never just one simple force.
Rarely, which is why you often end up with comminuted fractures, the bones in 3 or more pieces. So yeah, the pattern really tells you about the energy, the mechanism of injury.
That's really cool. So, okay, the bone's broken.
Yeah.
Vets have figured out how it likely happened from the pattern. How do they actually talk about it? This classification system sounds super important.
Oh, it's absolutely critical. It's the common language. It lets vets communicate quickly, plan treatment, and even predict the outcome, the prognosis.
So what are the key things they look at?
First, big one. Skin integrity. Is it open or closed?
Open meaning the bone came through the skin.
Exactly. Or there's a wound connecting down to the fracture. We call that a compound fracture too, and that's an orthopedic emergency. Huge infection risk.
Okay, big red flag.
Massive. Open fractures even get grade the first 2 and 3 based on how bad the soft tissue damage and contamination is. Closed means the skin's intact. Much better scenario.
Right. What else?
Then the extent. Is it complete, broken all the way through, or at least 2 pieces?
Right.
Or incomplete, like a green stick fracture you might see in young animals where it doesn't go fully across?
Green stick, like bending a fresh twig.
Precisely. Then anatomic location. Which bone and where on the bone? Is it mid-shaft, the diaphysis? Near the end, the metaphysis or epiphysis? Does it go into the joint articular? Or, in young animals, does it involve the growth plate, the physis? That's crucial because damage there can affect growth.
Ah, okay. Lots to consider.
And finally, the fracture configuration, the geometry. Is it simple, just 2 pieces, like transverse, oblique, or spiral? Or is it comminuted, 3 or more fragments? And if it's comminuted, can we piece it back together? Is it reducible, or is it just too shattered, non-reducible? All that guides the repair strategy.
Wow, okay. That's a lot packed into a classification.
Yeah.
But even with all these ways bones can break, they have this amazing ability to heal. How does that actually work?
It's pretty incredible, isn't it? Bone healing happens in two main ways, and it mostly depends on how stable the fracture is.
Stability is key then.
Absolutely. So you have direct bone healing or primary healing. This happens only if the fracture ends are perfectly put together, no gap, and held absolutely rigid thing, a strong compression plate.
So surgical intervention usually.
Almost always requires rigid internal fixation, yeah. It's slower, doesn't form a big lump of external callus, but it restores the anatomy perfectly.
Okay, on the other way.
That's indirect bone healing or secondary healing. And this is much more common. It's what happens with casts, splints, external fixators, even less rigid internal fixation like pins. It's a multi-stage biological process.
Walk us through that.
Okay, so right after the break, you get inflammation and a blood clot, a hematoma, that's stage 1, kicks everything off.
Right.
Then this hematoma starts to organize, forms granulation tissue, and then a soft callus, basically weak scar tissue and cartilage. It bridges the gap but isn't strong yet.
Okay, like scaffolding.
Kind of, yeah. Then comes hard callus formation. The body replaces that soft callus with woven bone. This is what you start seeing on x-rays, that lump around the fracture. It provides real strength.
Ah, so that lump is the hard callus.
That's it. And finally, over months, sometimes even years, you get bone remodeling. The body gradually replaces that bulky woven bone with stronger, more organized lamellar bone. It reshapes itself back towards the original form, following Wolff's Law.
Wolff's Law.
Yeah, it basically says bone adapts to the loads placed on it. So as the animal starts using the limb again, the bone remodels along the lines of stress to get stronger where it needs to be. We use x-rays to watch this whole process unfold.
Fascinating. But I imagine it doesn't always go perfectly.
Yeah.
What are the common problems, the complications?
Unfortunately, no, things can definitely go wrong. There are biological complications, like malunion.
Malunion, meaning it heals crooked.
Exactly. Heals in the wrong position, maybe shortened or angled. Then there's delayed union. It's healing just way slower than expected. And non-union, where healing just stops altogether.
Stops completely. Wow.
Yeah, it can happen. Sometimes there's lots of callus, but no bridging. Sometimes very little callus if the blood supply is bad. And the big one, especially with open fractures, is osteomyelitis. Bone infection. That can be devastating.
Infection sounds really bad.
It is very difficult to treat.
Yeah.
Then you have device-related complications. Implants, plates, screws, pins can bend, break, pull out.
Ouch.
Yeah, especially if the fracture wasn't perfectly reconstructed or if it's a non-union situation. And casts aren't risk-free either. They can cause awful pressure sores, cut off circulation, or lead to fracture disease, stiff joints, wasted muscles from being immobilized too long.
And does age play a big role?
Huge role. Young animals, they heal incredibly fast, active bone growth, great blood supply, but their growth plates are weak points, easily injured.
Right, the fizz you mentioned.
Exactly. Adults have stronger bone, but it's more brittle, and their healing capacity is slower, reduced, so they're more prone to those delayed unions, non-unions, and implant fatigue.
Okay, so we've got the universal principles down. Now let's get into the specifics. Let's start with the Camelidae, llamas, alpacas, dromedaries. What makes managing their fractures unique?
Well, this is where it gets really interesting because, perhaps counterintuitively, they're often considered exceptionally good patients for orthopedic work.
Really? Why is that?
Several reasons. First, their foot anatomy. They're tylopods, not true ungulates. They have these broad, leathery pads, not hard hooves.
Ah, padded feet.
Right. Provides good stability. But the real key is their temperament and size. Especially South American camelids, llamas, and alpacas, they're typically quiet, stoic.
Stoic.
Yeah. And compared to, say, a horse or even large cattle, they're smaller, lighter. This combination means they tolerate things like casts and splints remarkably well. They handle stall rest, and they're pretty good at getting around on 3 legs if needed.
So less risk of complications from just being laid up.
Much less risk compared to horses, for example. And their size means vets can often use implants designed for other species, large dogs, sometimes even human implants, alongside horse implants, more options.
That adaptability sounds like a huge advantage.
Yeah.
So what kinds of fractures are most common in camelids?
Trauma is still the main cause, and interestingly, it's mostly younger animals, under 2 years old. In llamas and alpacas, the most frequent breaks are in the lower leg bones, the metacarpus and metatarsus. Then radiosulna, femur, tibia, humeral fractures, upper front leg, happen sometimes, often from ales chest-butting each other.
The fighting behavior.
Yep. In young dromedary camels, the tibia seems to be the most common long bone break, followed by the radius.
Now, I heard something about a really specific fracture being almost predictable in dromedary camels. Is that true?
You heard right. It's the classic case of mandibular fractures in dromedaries, the
Ugh.
lower jaw.
Okay. How common are we talking?
Amazingly common. Studies show it accounts for something like 44% to 55% of all fractures reported in dromedaries.
Wow. Half their fractures of the jaw.
Pretty much. And it's overwhelmingly in adult males, especially during the rutting season.
Why then? More fighting.
Exactly. They get super aggressive, bite each other, bite fences, bite anything hard. And their mandible has these anatomical weak spots around the big canine teeth and where certain nerves exit.
So it's set up to break there.
It seems predisposed, yeah. Usually breaks on both sides, transversely, often open because of the location.
That predictability,
Mm.
does it change how vets approach it?
Absolutely. It shifts from just reacting to injury to proactive herd management, like maybe separating males during rut or modifying enclosures to remove things they might bite. Prevention becomes key.
Makes sense. And how do they fix it?
The standard and very successful treatment is interdental wiring, IDW.
Wiring the teeth together.
Essentially, yes.
Yeah.
Using wire wrapped around the teeth across the fracture line to stabilize the bone fragments. It's simple, cheap, can often be done in the field, and has a really high success rate, over 80%.
That's pretty neat. Field applicable too.
Yeah. Then just soft food, keeping the mouth clean, and they usually heal up great.
Okay, so mandible aside, for other camelid fractures, how do vets diagnose and plan?
Well, the clinical exam is first. Obvious lameness, usually non-weight-bearing, swelling, pain, maybe feeling that crunching crepitus. And critically, checking blood flow and nerve function below the break. But radiography, x-rays, that's the gold standard.
You need to see the break clearly.
Definitely. You need at least 2 views, 90 degrees apart, high-quality images to really assess the fracture type, displacement, everything needed for planning the repair. Sedation helps get good positioning and reduces stress.
So once diagnosed, what are the main treatment paths for a broken camelid leg?
Vets have a good toolkit, often adapted from other species. For simpler, stable fractures, especially lower limb and young ones, external coaptation casts or splints works well. Fiberglass is usually preferred.
And they tolerate those well, you said.
Exceptionally well.
Yeah.
Just need good padding and immobilizing the joints above and below. For tougher distal limb breaks, maybe comminuted ones, transfixation pinning and casting is great.
How does that work?
You put pins through the bone above the fracture and then incorporate those pins into the cast. It transfers the weight-bearing forces through the pins and cast, bypassing the fracture site, creating a really stable setup.
Ah, clever. Suspending it almost.
Exactly. External skeletal fixators, ESFs, those external frames with pins going into the bone are also really useful, especially for open fractures where you need to manage wounds. Provides rigid stability.
Yeah.
But often, the best outcomes come from internal fixation. Plates, screws, pins inside the bone, maybe interlocking nails.
Surgery, basically.
Right. It allows for precise anatomical reduction, rigid stability, faster healing, earlier return to function. It's usually the go-to for fractures involving joints or the femur and humerus, which are hard to stabilize externally.
Makes sense for those big upper leg bones.
Yeah. And sometimes vets will even add things like bone marrow aspirate from the patient to boost the healing response.
So overall, what's the outlook? If a llama breaks its leg, is it likely to recover well?
Generally, yes. The prognosis is often favorable to excellent. We mentioned that study with 89% survival in llamas and alpacas. Dromedaries also do well, especially with external fixation.
That's really positive.
It is. But it hinges on that meticulous post-op care, antibiotics, pain release, strict confinement, careful monitoring. Complications can happen, but their resilience and cooperation make them honestly rewarding patients.
Okay, so camelids seem like relatively straightforward orthopedic patients, all things considered. Now, let's shift gears completely to the Cervidae family: deer, elk, moose. You said earlier it's night and day. Why is managing their fractures so incredibly different?
It really is a stark contrast, the biggest factor. Their wild or semi-wild nature just fundamentally constrains everything. The surgical principles are the same, but actually applying them safely and effectively, that's the challenge.
How so?
It means that often the most humane and practical approach for a fractured wild deer isn't complex surgery, but actually non-intervention or sometimes, sadly, euthanasia.
That's tough. So what causes their fractures usually? Is it different from camelids?
It's almost exclusively trauma. But the type of trauma is often different. In North America, the massive issue is deer vehicle collisions, DVCs.
Car accidents.
Yeah, over 1 million a year in the U.S. These are high-energy impacts. They cause severe, highly comminuted, often open fractures, long bones, pelvis, spine, plus frequent internal injuries that are life-threatening on their own.
1 million a year. That's staggering.
It is, and it's an anthropogenic problem human-caused linked to roads cutting through habitats. So the treatment, in a broader sense, involves things like wildlife crossings, road design, driver awareness, not just fixing individual deer.
Right, population level thinking. What else causes breaks?
Well, you still get intraspecific conflict, especially males fighting during rut antler damage. Sometimes fractures. Falls happen, especially fawns in rough terrain. That can lead to malunion if they survive. And predation attempts, if the animal escapes, it might be left with severe injuries, including fractures.
Okay. But you mentioned a major constraint earlier. If you find an injured deer, say from a DDC, what's the single biggest hurdle to actually helping it?
The single greatest limiting factor, the thing that overshadows everything else, is capture myopathy, or CM, also called exertional rhabdomyolysis.
Capture myopathy. What is that?
It's an acute metabolic disease triggered by extreme stress and exertion, the very act of chasing, capturing, handling these animals.
The stress itself can kill them.
Yes, it has a devastatingly high mortality rate. So trying to rescue or treat an injured wild deer often carries a significant risk of causing its death through CM. It's a terrible paradox.
That's incredibly difficult. What's actually happening inside the animal during CM?
It's a catastrophic physiological cascade.
Hmm.
Extreme fear and exertion shifts their metabolism to anaerobic. This causes a massive buildup of lactic acid.
Okay.
That leads to severe metabolic acidosis, which damages muscle cells rhabdomyolysis. The dying muscle releases myoglobin,
Which is toxic.
highly toxic to the kidneys, leads to acute kidney failure. It's often fatal, and CM can manifest in different ways: sudden death minutes after capture, or hours or days later with muscle stiffness, staggering, dark urine, kidney failure, sometimes even weeks later with heart muscle damage. It's unpredictable and often irreversible once it gets going.
So, if treating CM itself is basically impossible, what can you do? Is prevention the only hope?
You've hit the nail on the head. Prevention is the only viable strategy. It's all about minimizing stress during any attempted handling.
How do you do that in the field? Sounds tough.
It is incredibly tough. Minimize chase time, ideally under 5–10 minutes. Reduce sensory input blindfolds, quiet environment. Work in cool conditions if possible, monitor temperature. And crucially, use chemical restraint sedatives or anesthetics, often delivered by DART rather than prolonged manual wrestling. Anything to reduce that extreme stress and exertion.
Okay, so given this massive risk of CM, how do vets and wildlife managers actually approach diagnosing and treating fractures in cervids? The decision-making must be incredibly complex.
It absolutely is. CM forces a very different approach, especially comparing wild versus captive settings. For a free-ranging wild deer, the stress of capture, transport, and surgery for a bad fracture is highly likely to be fatal due to CM.
So often doing nothing is better.
Counterintuitive as it sounds, yes. Many wildlife agencies recommend non-intervention for deer that can still move, even with a broken leg, because their chance of survival might actually be better if left alone. Capture can be a death sentence.
So field triage often leads to
Either non-intervention, or if the injury is clearly incompatible with survival or poses a public safety risk, humane euthanasia in the field. Active treatment for complex fractures in wild deer is very rarely a viable or humane option.
And what about farm deer or those in zoos?
It's more feasible there, as they might be somewhat used to human presence, but they are still highly susceptible to CM. You need specialized, quiet facilities. Treatment options might include stall rest, maybe casts for fawns' lower leg breaks. External skeletal fixation, ESF, is often preferred for complex fractures in captive cervids.
Why ESF?
Because it provides good stability, but involves less surgical trauma and time compared to extensive plating. Reduces the anesthetic risk and handling stress somewhat. Internal fixation with plates and screws. Technically possible, but the recovery period is incredibly risky. If they panic and struggle violently coming out of anesthesia, they can catastrophically damage the repair or themselves.
So even in captivity, it's fraught with risk. What about wild deer then? If left alone, can they actually heal a broken leg on their own?
This is where it gets kind of bittersweet. Looking at skeletons in museums, yes, there's clear evidence wild deer can survive major fractures. You see bones that healed with huge calluses.
So they live for a while after the break.
Exactly, especially if they were young when it happened. But what we see in the field today suggests that for an adult wild deer, surviving the initial injury and healing the bone often isn't enough.
Why not?
Because it usually heals badly, severe malunion. They end up chronically lame. That makes it incredibly hard to find food, keep condition, and crucially, escape predators. So even if the bone heals, The functional outcome is often fatal indirectly.
That's a harsh reality. But I heard something about deer antlers having some connection to healing.
Yeah, that's a fascinating area of research. Deer antlers regenerate incredibly fast every year. It suggests cervids might have some enhanced intrinsic bone healing capacity, maybe linked to specific growth factors like BMP2 that are involved in antler growth.
So they might have the potential to heal well if they could just avoid the other complications.
That's the intriguing possibility, yes. If they survive the trauma and avoid predation and the consequences of lameness, their underlying biology might be quite good at fixing bone. But getting to that point is the challenge.
Okay, let's pull back a bit. Comparing these two groups, camelids and cervids, side by side, what really jumps out at you is the key differences in fracture management.
The most striking thing is how profoundly the animal's inherent biology, its temperament, and its environment dictate what's possible and what's successful.
Okay.
With camelids, you see fractures often linked to specific behaviors, like those dromedary jaws during rut. They're often predictable, manageable with standard techniques. They heal well. They tolerate being patients. The prognosis is generally good.
The cooperative patient.
Exactly. With cervids, it's usually high-energy trauma from the environment, like DVCs, really bad breaks. And while they might have this underlying potential for good healing, maybe from that antler biology,
It's overridden by the stress.
completely overridden by the near certainty of triggering fatal capture myopathy if you try to intervene significantly in a wild setting.
So it really boils down to their reaction to us, to being handled.
That's the absolute core of it. Camelids, docile, stoic. That allows examination, anesthesia, surgery, casts, stall rest, follow-up, high success. Cervids, quintessential flight animals, innate high-stress response. Handling directly causes a potentially fatal disease.
So the same procedure can be routine in one and deadly in the other.
Precisely. Which brings up that crucial veterinary principle, primum non nocere. First, do no harm. For a wild deer, doing no harm often means not intervening, because the intervention itself poses a greater threat than the original injury. It forces you to redefine humane treatment based on the species and context.
That's a really important, if difficult, distinction.
It is. You move from thinking, we must fix this, to what action truly minimizes suffering for this specific animal in this specific situation. Sometimes that action is stepping back.
Looking ahead then, with these huge challenges, especially for cervids, what's on the horizon? Are there any advances in large animal orthopedics that might offer some hope?
Well, the field is always evolving. For internal fixation, things like locking compression plates, LCPs, and interlocking nails provide much better stability for complex fractures. These are already being used more in camelids and could improve outcomes further.
Could they help captive cervids?
Potentially. Maybe using minimally invasive techniques to apply them could reduce surgical stress. But that recovery phase, that remains the major hurdle for cervids regardless of the fixation method.
Right, the waking up part.
Exactly. There's also more focus on biological osteosynthesis techniques that prioritize preserving the body's own healing mechanisms, the blood supply, the fracture hematoma. Things like ESFs and transfixation casts fit this philosophy.
Working with the biology.
Yes. And then there's the really exciting research into biomaterials and growth factors that work on deer antler regeneration, understanding the role of factors like BMP2. It opens doors.
Oh, so.
Could we develop therapies, maybe derived from antler research or bio-inspired by it, to actively accelerate bone healing? That could potentially benefit both camelids and maybe make surgical outcomes more reliable in captive cervids if healing could happen faster.
Interesting. So boiling all this down, what are the key takeaways for vets, wildlife managers, people actually dealing with these animals on the ground?
Okay, for practitioners treating Camelidae, go for it. Embrace a high standard of care. Treat fractures aggressively, especially complex ones or those near joints. Internal fixation is often best there. Use appropriate techniques like IDW for jaws, transfixation casts for lower limbs. And remember, meticulous post-op care is crucial for that excellent prognosis.
So lean into treatment for camelids.
Absolutely. Now for Cervidae, it's almost the opposite mindset, driven by CM Priority 1. Prevent capture myopathy. Minimize stress in every single interaction. Use chemical restraint. For wild cervids, adopt conservative triage. Recognize that non-intervention or humane euthanasia is often the most ethical path for severe fractures in mobile adults. Reserve intervention for specific cases like public safety or maybe fawns.
And for captive ones?
Optimize the captive management. ESF might be the better choice for complex breaks, ensure a super quiet recovery environment, and for wildlife managers. Focus on population-level prevention. DVC mitigation strategies are key.
That's a really clear contrast in approaches.
It has to be driven by the animals themselves.
Well, this has been a truly fascinating deep dive. We've gone from, the specifics of a camel's jaw fracture treatable with simple wiring to the profound challenge of just trying to approach an injured wild deer without causing more harm through stress. It really hammers home how much biology, behavior, and environment shape everything.
It absolutely does. It highlights that understanding these species-specific details isn't just, academic trivia. It's fundamental to providing effective and, importantly, humane veterinary care and wildlife management. What works for one just doesn't work for the other.
And maybe it leaves you, our listener, with something to think about. That complex question of when our attempts to help might actually cause greater harm. How do we best align what we can do with the deep biological realities these animals live by?
A critical question indeed.
Thank you for joining us on this deep dive.